You may have heard stories raising questions about Johns Hopkins Health System's charity care and medical bill collection practices. This is a complex issue, and I want to be sure that you have the facts about our policies and our practices. First, as a nonprofit healthcare provider, we are committed to providing world-class health care to all who need it, regardless of their ability to pay. As part of that commitment, on average, we provide an extraordinary $32 million in free medical care to low-income patients every year. Second, it is important to know that Maryland hospitals are required to attempt to collect payment from patients who have the ability to pay all or part of their medical bills. By doing so, we can ensure that those who need free care are able to receive it. I want to be very clear about this. If a patient at any point demonstrates financial hardship, we make every effort to ensure that they have access to the resources that may help reduce and, in many cases, eliminate the costs of care. Patients are contacted more than a dozen times by mail or phone over the course of several months to explain how they can enroll for payment plans or charity care if they are having financial hardships. Only after a patient has repeatedly declined to respond to or engage with us will Johns Hopkins honor our regulatory responsibility to the state and, like all other hospitals in Maryland and around the country, pursue payment. In all cases, legal action is an absolute last resort. As a result of our comprehensive patient counseling process, only a very small portion of our more than 2 million annual patient visits across Johns Hopkins Health System reach the point of debt collection. You see, we must fulfill our commitment to ensure that all of our patients have the support they need during times of financial hardship. This is an important conversation, and it's one that we are committed to continuing with our community as we work, like we always have and always will, to ensure that cost is not a barrier to care for any of our patients. I thank you.